Tamika Evans, if you have PCOS and have had a hysterectomy, will that help with the PCOS system? PCOS is an acronym that means Polycystic Ovary Syndrome. And unfortunately, taking out the uterus will only stop you from having those types of issues like bleeding and possibly uterine cramping. It usually causes some abnormality in your menstrual cycle, but it does not change the issue, which is your ovaries, unless you get your ovaries taken out at the same time. That would be a total hysterectomy with a salpingo oophorectomy, which means they take out the ovaries and the tubes as well. Most people are not getting that. They're saving their ovaries, which means you could still have PCOS. They may take out one ovary. It's a variety of different ways to treat that. The most common thing, as a matter of fact, is a diabetes medication called metformin that calms down that entire system. It helps you also keep your weight down and keep your blood sugar from stop you from becoming a diabetic. So people that have polycystic ovary syndrome can have issues with their diabetes system, their hormones, and they can become diabetic. It also causes hirsutism. They usually have mustaches and hair on their face. And they also usually are overweight. It causes you to dispense weight in your hips and thighs and abdomen. So you get a big stomach with large hips and thighs. Now, the question was thought, well, maybe it was the people that had big hips and thighs that were overweight that got polycystic ovary syndrome, or is polycystic ovary syndrome the cause of those things? We really don't know what comes first, the chicken or the egg, but the bottom line is that it's highly unusual to have polycystic ovary syndrome in a patient that is not overweight. So I just had one of my patients was referred to an OB-GYN, and they had that diagnosis that was totally, completely unexpected from my perspective, because I diagnosed PCOS. I don't refer people for that, but I did. She did. She got evaluated, and that was the diagnosis. So I'm still seeing how this is going to work in real time with her. So great question, Tamika. We appreciate you, and thank you for being a regular on this show.